Good afternoon. My name is Will Stasinas. I'm a student physical therapist here at RMU. And today we will be treating Kenneth here. He is acting as our 36-year-old female patient that has been experiencing some back pain for about 4 months after having her daughter. And what we'll be using today to treat this back pain, is biphasic pulsed TENS current. So this is a form of electrical stimulus to help pain reduction, either acute or chronic. So before we get going, there's a couple indications and contraindication questions that I have to ask our patient to make sure that this modality is fit for that individual. So as I just said before, an indication for this type of treatment would be acute or chronic pain, in addition to like any muscle spasming that may come along with like that localized discomfort that our patient's having. Any contraindications that I'm going to ask is, do we have any history of like deep vein thrombosis or blood clots?
No.
Okay. And because this is a female patient that has a history of pregnancy, I do have to ask, are you currently pregnant?
I am not.
Okay. Are we sure we're not currently pregnant?
I am positive.
Perfect. Do you have a history of miscarriages by chance?
No, sir.
Okay. We also want to make sure we don't have any impaired mentation from our patient, but because it can answer our questions and are pretty aware with our situation here, obviously that box is checked. We also want to make sure that we don't have any cardiac abnormalities. Do you have any known cardiac issues or circulatory issues?
No.
Perfect. And then lastly, we want to talk about where we can and cannot apply this type of treatment. So obviously we want to stay clear of the gonadal area, our eyes, lateral neck, or anywhere that our phrenic nerve is superficial, because that innervates our diaphragm, so we don't want to change any of our breathing patterns with this type of modality. So before we get going, Kenneth, do we have any questions or concerns as to why we would perform this modality on you?
No,
Okay.
no, I do not.
Is everything I said sound comfortable to you, and are you ready to begin?
I am ready. Yes,
Perfect.
This is good to go.
All right. So what we're going to do here is we're going to take our ES machine that's already on, and then I'm going to apply these leads in the form of these silicone-based pads to his or her lower back where they're experiencing that localized discomfort. Looks good. And then before we begin, we had the patient prepped in a prone position, have some pillows under their abdominal area to kind of help cause that lower back to come into some flexion, allowing for a better area of treatment, in addition to some draping kind of below that hip area. So as far as what parameters we'd set for this type of modality is the time is preset to 10, but you can do it from anywhere from about 10 to 30 minutes for, again, that pain reduction. We're going to change our rate or frequency to 10 to 250 hertz. So that's a very wide range. Today we're just going to do 50 hertz. So that falls under that conventional TENS parameter range. Then we're going to change our width, our current width, or pulse duration. And to fall under that conventional range, it has to be anywhere under 100 microseconds. So we are set at 75. So again, falling within that level. And as far as amplitude of the current, we only want to activate sensory fibers. So we don't want any muscle contraction in that area. So we're only getting those beta fibers innervated. So we don't want any muscle contraction. So with that said, Kenneth, you feel comfortable to start here?
I feel comfortable, yes.
All
Thank
right.
you.
Let's make sure this pad is staying down there. Perfect. All right. How you feeling?
Feeling good?
Yep. Any tingle yet?
No, I don't feel anything.
Okay. Anything now?
Yeah, I'm starting to feel a little tingle.
Perfect. So we'll leave it right about there. And that was a little higher than that 50 hertz frequency that I talked about earlier, where we ended up being at 55. So the timer automatically set to 10 minutes, but again, we can do it anywhere from 10 to 30 minutes. And just to show you on our stim machine, time set, rate at 50, width at 75, intensity at 55, and we're using a biphasic current. All right. Still getting that tingle?
A little bit, yes.
Perfect. I remember during our interview process and kind of eval, you said that your pain was about a 6 out of 10 the majority of the day. Do you feel any difference so far with this treatment?
Yeah, I would say it takes the pain away a little bit.
Okay.
3 or 4
Okay.
out of 10 right now.
All
Yeah.
right. So just after a minute or so, we are getting a bit of that sensory distraction, allowing the patient to realize they may not be in chronic pain anymore, and we're getting those sensory nerve fibers to be activated. So for the sake of this video, we will not do it for the full 10 minutes. So I will go ahead and stop our treatment really quick, and we always want to make sure our machine is off before we remove our leads again from our patient. And then we are going to reassess the area, make sure we don't have any visual burns, redness, or aggravation that is unwanted. So with that, thanks for watching. We'll see you next time.